Hi, everyone, and Happy New Year. I hope everyone had some time with family to recharge, connect with friends over the break, and now is ready to start 2024. I know this is going to be our best year ever. I'm David, and I want to welcome you to another edition of Oracle Health Inside Access. This is our time monthly to get together and demonstrate our commitment to literally change the global healthcare landscape. I hope you've all been as invigorated with these webcasts as I have. So let's keep this momentum going. Please share your questions and your feedback by using the Zoom Q&A function. I've been spending a lot of time with our customers, and the feedback is really clear wherever I go. First, they're really excited about our strategy. It really makes sense, this open, connected platform that pulls things together, technology that's going to make it so much easier to care for patients, bringing in disparate parts of health information so that you have the right information at the right time, whoever you are in this healthcare ecosystem. And at the same time, they're also still very focused on making sure we deliver some foundational parts of the electronic health record that they've been waiting for a long time. So as we embark on 2024, to me, it's really two things. We got to get the basics right. And I think we're now set up within great technological accelerations that allow us to do that. And at the same time, start delivering on this pretty amazing vision. This month, our episode revolves around our modernization efforts to advance clinical workflows. Simply put, we're going to use technology to make it easier for caregivers to care. One of the products that we'll highlight is our new Oracle Clinical Digital Assistant. This thing is going to be game-changing. For anyone who saw me demonstrate this on stage at Oracle Health Conference this fall, or has ever heard me talk about it, you're going to know how excited I am about what this is going to do for doctors, nurses, and other frontline folks who are taking care of patients. Imagine, before you go in to see a patient, this Oracle Digital Clinical Assistant summarizes everything you need to know. And then you enter the room, and with the patient's permission, using ambient listening and interaction with Oracle Health, you're able to complete your visit with the patient without ever touching the computer. No clicks. We're talking about being able to spend the entire visit looking in the patient's eyes, doing physical exam, asking Oracle Assistant for information, and at the end of the visit, what's done for you is the doctor's note or the nurse's note, the note to the insurance company, the after-visit summary for the patient, your orders. Everything is done with the technology running in the background. This is completely game-changing. But we're not going to just focus only on big splash new tech efforts. Our modernization efforts span across Oracle Health, including many of our foundational products, as well as bringing in native Oracle technology and products into healthcare. We really have a great lineup for you today to show you a number of those advancements we're making. With that, let me hand it off to Suhas, Senior Vice President of Product Management for Oracle Health.
Thank you for the introduction, Dr. Feinberg. I am excited to keep the conversation going and show everyone how we've been tackling modernization. Before we move on to more of the clinical specific updates, I wanted to further emphasize the migration to OCI as a topic that has been discussed on each of our previous Inside Access webcasts. This critical shift should help each of our customers in terms of application performance and security. So how do we get there? We get there by modernizing the EHR. Our approach to modernizing the EHR is to invest in new capabilities by infusing cutting-edge AI and creating new user experiences, generating open APIs for customers and third parties to create innovative, integrated solutions. We acknowledge and we know that you have deployed Millennium today. So we're going to do this innovation and modernization by continuing to improve Millennium, meeting your high priority requirements. In order to minimize disruption, we are going to gradually introduce these new capabilities which will coexist with your current Millennium. How do we plan to modernize this? We have a number of different click stops to get to our modern EHR that's cloud native, web and mobile, embedded AI, and with open APIs. We're going to improve now the current usability of Millennium, and we continue to add capabilities getting us towards the North Star. Some examples of that are to reduce the physician burnout with some innovative technologies infusing AI with the clinical digital assistant that Dr. Patel will talk about. Enhancing reliability and reducing costs with the Oracle Cloud Infrastructure. Talking about the Oracle Cloud Infrastructure, it is our cloud platform for delivering apps to our customers. We have built the playbook on taking applications designed for on-premise and completely migrating them onto a cloud-native application. We have the largest number of data centers with 46 regions in 23 countries. And why does this matter to you? Because the Oracle Cloud Infrastructure is designed for applications with a one Oracle integrated cloud, so you can integrate not only your clinical applications, but also your support applications like the human capital management, ERP, and supply chain. We've already started upgrading all of our customers and migrating them into the cloud. And just last month, we moved over 400 plus customers over to the Oracle Cloud Infrastructure. And we have an aggressive timeline to continue to move all customers over to the Oracle Cloud Infrastructure. Now, one of the advantages of OCI, the Oracle Cloud Infrastructure, are all the AI services that are pre-built. We have AI services that are used by all of Oracle applications today, and we're just leveraging this to add intelligence to healthcare. We're doing this by embedding AI into a number of different solutions, starting with clinical, and you'll see more with Dr. Patel when he talks about the clinical digital assistant that's voice-enabled clinical workflows, automated note generation, proposed actions, and we have a number of other solutions that we're working on for summarization, such as the patient discharge summary generation and pre-visit summarization. On the consumer side, enabling the digital assistant for consumers to be able to do self-service like scheduling and rescheduling and getting information about their records, as well as using AI services like document imaging to be able to take a picture of your driver's license or your insurance card and completing the registration without having to type all of that. So we have a very exciting roadmap of all these AI capabilities that we're going to infuse into our healthcare solutions. Moving over to connectivity, we are building an open, interoperable, API-driven healthcare platform where customers and partners can connect, integrate products, and move data seamlessly. Healthcare ecosystem is all about integrated apps, and we're going to do that in two ways. One, we're going to generate a number of APIs. We're going to expose all these APIs that are going to enable our ISVs, our partners and customers to build innovative apps to our EHR. In addition, we'll have packaged integrations that help you get there much more faster and move data seamlessly so you can get a full view of your patient record. In today's digital age, providers, payers, pharmacies, public health expect and rely on us to provide an interoperable, secure, consistent, and easy to integrate healthcare platform. Our portfolio for interop spans the entire healthcare portfolio, providing seamless integration that can extend your ecosystem globally. We strive to provide actionable insights from the data exchange, utilizing the ever-expanding US CDI and FHIR standards, and enabling and ensuring that we are able to reduce and eliminate the need for creating these manual interface mappings. Within the AHR, we are getting all this data from multiple systems, but automating them so we can deduplicate all this data and create roll-ups so the clinicians spend time for the patient instead of trying to make sense of all this duplicate data that's out there. This is going to enable our customers and partners to create innovative, complete workflows spanning multiple systems so they can focus on what's most important to them: patient safety, patient health, and their business needs. So we have a really exciting roadmap here where we're focusing on driving innovation in seamless exchange, which gives us that data exchange capability, in electronic prescription interoperability and health electronic case reporting. Now, traditionally, data integration and workflow enablement were done through traditional HL7 interfaces and now more recently with the FHIR standards. Oracle is 100% committed to take part in these standards and drive regulatory requirements through the FHIR APIs. On the right, you'll see an ever-expanding API library of these FHIR APIs that we will deliver. However, our customers are asking us for a lot more than that. They want deep integration into the EHR that's performant and reliable. And recently at Oracle Health Conference, we announced that we will increase our API footprint by over 300%. So we are, as part of our modernization, we are creating a number of APIs as we build these new applications like the clinical digital assistant and the patient administration. We are leveraging the same APIs we're using and enabling them for you. Examples being allergy, chief complaint, and so on and so forth. So over the next few months and quarters, you'll see us generating a number of these APIs that you can use to enable and start innovating in your applications, in your environments. So now that I've set the stage on the impact of data and the underlying foundation our platform sits on top of, in terms of innovation, let me shift back to focus more on the clinical community. To do so, I now hand it off to a couple of clinicians who will share how we are working to advance clinical workflows. First up is Ashley George, Vice President for Clinical Product Management and Strategy. With a background in medicine, Ashley began her career in ICU care. Ashley?
Thank you, Suhas. Hello, everyone. I'm Ashley George, Vice President of Clinical Product Management. I'm excited to join you today to share with you the things that we're working on over the last 12 months and the things that we have coming in the next 12 months. But it's important to remind ourselves the work that you guys do each and every day is so critical to the mission of healthcare. And our duty here at Oracle Health is to ensure that we're supporting you every step of the way. We know that you are faced with tremendous challenges across the board, from retention, clinician burnout, regulatory pressures, to changes in payment models. Our goal is to ensure that we're providing you the best technology and EHR that you can leverage to be able to support healthcare across the world. So how are we advancing the EHR? You heard earlier from Suhas how we continue to be focused on an open and interoperable ecosystem. We also, at the same time, want to ensure that we're providing you with a solid foundation EHR that is performant, safe, and reliable. We also will introduce technologies through new automation to ensure that we are helping to advance healthcare and minimizing the amount of steps and manual workflows that your clinicians have to touch. In addition, we've heard that there's opportunities to advance usability or functional gaps across the workflows and product sets. Our goal is to collectively take all of these things so that we can provide you the best EHR experience to be able to deliver for your patients around the globe. So let's talk about some of the things that we've been recently doing over the last 12 months. This is a view of all the different workflows and product areas that we have been touching to improve the EHR experience. This is not the exhaustive list, but a highlight of some of the things that I think will be important to you. It is also important to note that all of this information can be found on the Solution Strategy portal. This information I've grouped based on different quarters over the last 12 months, and I'm going to do a deeper dive into some of the key highlights. If we look back to about this time, about 12 months ago, we focused on some of the feedback that you, our customers, continue to share with us around how do we continue to think about how we approach the EHR and really looking at those core workflows that are being used each and every day by your physicians and your nurses. One of the main call-outs from your clinicians were, hey, we want an easier way to be able to help manage our problem list. We wanted to also be able to improve some of the different ways that you're interacting with things such as Media Gallery. So through that work, some of the new introductions that we've put in place were to be able to introduce what's called the problem summary. This problem summary is a way for your clinicians to be able to see the historical summary of what's happened to that patient over time. I also just mentioned the media gallery. This was an opportunity to be able to uplift the media gallery to be able to include things that you've asked for, such as annotation. We also released a really exciting new offering within the emergency medicine space and our trauma documentation. This allows your clinicians who historically have managed this either on paper to be able to manage some of those most critical trauma events. We've digitized this, being able to capture this information within the electronic medical record. Another area of focus was around the critical care dashboard. We know that it's incredibly important for your end users, your clinicians, to be able to have access to information within the electronic health record that shows information about the patients, the hemodynamics, in relation to the patient's medications. By introducing the critical care dashboard, this allows your clinicians to be able to see all of this information in context within the EHR without having to navigate outside the EHR to receive this information. In addition, making sure that we continue to have a focus on dosing precision and medication reconciliation. The importance of how you manage medications is a critical patient safety element for your organizations. So within that, we were able to introduce, through feedback and working with your organizations, the ability to add a height and weight look-back period for when you're managing your pediatric populations, for example. We also know that the medication reconciliation can be challenging at times. So being able to add in indicators such as a PRN indicator, face up, and additional comments, right, when you're doing that meds rec is now present in the workflows. In addition, as nurses are taking care of patients and going in inside of each of their rooms, it's so important that we allow the clinicians to have the mobile tools to be able to do their job. We had released over the years the ability to do mobile medication management as well as specimen collection, but some of the feedback that we continued to hear from you was the ability to do documentation. Well, the first step in this journey was for us to release the pain assessments, and this is now currently available for your organizations. So now let's talk about our planned roadmap. As we look forward to the next 12 months, through conversations with you, our customers, through different forums, whether it be our collaboration forums, our councils, through survey results, through different engagements, we've heard from you that there are some top themes of areas that you're looking for advancements within the EHR. This ranges from better management of problem list, to message center and care coordination with referrals, to more efficient ways for charting and documentations and medication reconciliation. So let's talk about the things that are planned for you. Here you're seeing a planned roadmap over the next several quarters. The intention here is to be able to target those key feedback items that we're hearing from you on those key themes around problem list, message center that I had just referenced. This certainly is not the exhaustive list of everything that we have planned, but I will take us through a little bit further in terms of some of the details of what you're seeing. One of the things that I'm really excited for is the collaboration that we have with our Oracle team and being able to accelerate many of the things that we've had on our roadmap to advance the EHR and have been able to accelerate those things onto the roadmap to be able to deliver from you. And that's being indicated by the green little flag next to the items. We also have the opportunity to infuse automation through generative AI. And so we will also be examining these workflows to see where we can reduce manual touches and be able to provide additional automation for your clinicians. So now let me take you through some examples of the things that are planned over the next 12 months. This quarter, in Q1, as I mentioned earlier, we had started the work last year around really looking at that entire EHR experience for your clinicians. And I'm excited to share that work that we started, that we've released some of the things last year around problem summary. We're going to continue to build upon that. And with that, you're seeing advancements around the EHR by being able to release and show the redesigned banner bar, being able to show additional information and one click away for more information that you need. We also know that it's important for your clinicians to be able to see information in context as they're doing. So the introduction of the workspace is also coming into view. And last but not least is the ability to provide those additional accelerators for your clinicians to be able to document, chart, do the things that they need to do for their patients in a more effective and efficient manner. One of the things that I'm highlighting here is the ability to do what I call selective or thoughtful carry forward of the note. So this is an example from your HPI, being able to look at what I had last recorded from a patient visit and being able to assess if any of this information is still relevant for my patient. And then I also have the footnote in terms of where it came from with that information. In Q2, we plan to be able to introduce auto text in orders to be able to help simplify your physician entry around prescriptions. In addition, we know that care coordination and referral process is instrumental to your businesses. We plan to be able to improve the closed loop referral process by introducing automation of the steps along the way to be able to make it more efficient for your end users. Another important update that we've heard from you is how do we continue to make sure that the information is in context to what you're viewing. So being able to see both your home medications in conjunction with your order. So this is allowing in your ambulatory clinics to be able to see both your current and your past encounter clinic information in the same view. Once again, one of those feedbacks that we've heard from you, our customers. And then another exciting thing planned is the ability to do discrete mobile charting beyond just the pain score. So those nurses that, once again, need to be able to do their ADLs, their I's and O's, their simple form documentation, being able to deliver that for our end users will be incredibly exciting and important to be able to automate a lot of those steps. And last but not least, the work that we have around Message Center is certainly top of mind for our clinicians. We know that our clinicians today are certainly, I'll say, inundated with a lot of information that's coming into the Message Center, where they are sifting through information from their patients, where they're trying to respond to look at critical labs and needing to place e-prescribe or medication renewals. And so you will see an evolved, more improved, automated experience across the Message Center as a whole. So that was a lot to get through in terms of what we have planned over the last 12 months. Once again, all of this information can be found on the Solution Portal, but we also look for ways to continue to stay connected to you. There are a multitude of connection points, so I will say that first and foremost, we host quarterly illumination sessions that certainly do a deep dive into the things that have been recently available. We also look for feedback from you all and your end users to join collaboration sessions from our nursing and our physician councils. And then for those of you who want to have a direct line into the design and the workflows that are happening in real time, please join our targeted EHR improvement work group that meets every other week on Tuesdays. Thank you.
Thanks, Ashley. My name is Dr. Jigar Patel. I've been at Cerner now Oracle 16 plus years, and I'm here today to talk to you about the exciting development we're doing with Oracle Clinical Digital Assistant. Oracle Clinical Digital Assistant is a speech, language, and generative AI enabled, voice-first, multimodal, mobile assistant for clinicians. It's my favorite sentence in the world to say, and I say it a lot. But if we break it apart, it makes a lot of sense. First, speech, language, and generative AI. Speech, you can talk to it. Language, it can talk back to you. Generative AI, we're going to create things with the inputs. From a design perspective, we always thought about how do you voice first, thinking second about touching or tapping the screen as opposed to that voice first interaction. It's going to be in your pocket, both iOS and Android, so it'll be with you all the time, and that gives us a lot of important context to design around. So with that, let's talk about the key functions that are going to come with it. I break them into 4 main functions, and they're the various assistances: clinical, dictation, actions, and conversations. Let's dig into those a little bit. First is the clinical assistant. That context I talked about allows us to design around the moment that you're in. I don't need the whole schedule. I need just the next 3 patients that you're seeing or who's here to be seen. If there are important things in your message center or other patient charts, we can alert you to those based on the time of the day, where you are, etc. And so that actually gives us a lot of freedom to think about how do we simplify the user experience as well. When we start to think about how do we have the patient in context, now I can start to use the clinical assistant to find information in the chart. What was the patient's last TSH value? Show me my last note. What's on the problem list? So we're going to allow the clinician to use their natural language to find information in the chart and not worry about learning what to say. The clinical assistant also allows us to command it to do things like adding to the problem list, etc., all with the voice input. Second to that is the conversation. So between a doctor and a patient, I can record that conversation. We're going to take that conversation and turn it into a note for the physician. This is actually going to also benefit us in a number of ways. As I talk through the plan of that, we're capturing that obviously, and then I'm going to be able to turn that into actions and orders, which is the third component to this. So in my visit, I recently said, hey, we're going to increase your blood pressure medication, we're going to have you follow up with some lab work in 90 days, and then we're going to have you see me back in 3 months. So with that, now the system is going to tee it up for them to say, would you like to order those things? Really taking them away from the keyboard completely, allowing them to totally do everything on their phone and focus on the patient. And finally, we talk a lot about addending notes. So in this particular use case, we have a clinician and she's actually going to say to the system, hey Oracle, I'd like to addend my note from my last visit. When she addends the note, she uses the built-in dictation software and actually is able to then sign it from her device. Quick interactions that allow you to get through your day more quickly. So with that, what are we hoping to achieve? We're hoping to reduce the amount of documentation time, chart review time, so that you can actually focus on the patient. We've seen anecdotally in our first beta 1 client, patients love this feature. They love the ability to say, the doctor looked at me. They weren't hiding behind the screen, and it really improved their engagement. We also are thinking about burnout. So if I can actually have the patient and doctor focus on each other, I'm actually going to improve their quality of the physician interaction, and that benefits both the patient and the physician as well. Over time, we're going to be able to add other things along the way in this base platform. This base platform will be built upon for a lot of different purposes, but really, now that we've unified these 4 capabilities together, we've got a good building block for the future. So with that, let's show you what it looks like. First, I'm going to show you what it looks like from a clinical assistance capability. The voice you're going to hear is me, and I'm going to interrupt myself here, which is kind of ironic in a way. And we're going to see how a clinician might gather information. The patient we're going to focus on is Grace Wolf. She's coming back after a week from a follow-up for a pneumonia visit, and we're going to see how she's doing.
Show the lab results for Grace Wolf.
Here are the 9 results. To see the full report, say the number.
Show the sputum culture.
Here are the details.
So you can see here, the system said I could use the number, but I chose to just use the words. Show me the sputum culture.
Show me my to-dos.
Here are your 11 to-dos sorted by priority, then due date ascending. You can edit, delete, or mark as complete.
Because we're on a mobile device, we're going to use toast notifications, like you're used to having on your phone anyway, to help to remind you to do things.
To identify the to-do, say its number.
Show my unsigned notes. How many times am I overbooked today?
There are 2 overbooked time slots remaining today. To learn about the appointments scheduled for a given time, say the number.
What free time do I have today?
You've got 6 open slots remaining today that are at least 15 minutes.
This lets me go ahead and organize my day and actually find times when I can squeeze patients in. There is always a waiting list of people to be seen, so it's a great advantage to understand when I can get people in additionally.
Show me my schedule.
Here are the 10 appointments matching today. Checked in, arrived or booked. To open the patient summary, say the number.
Open the chart for Grace Wolf.
Here's the summary for Grace Wolf.
Read it to me.
Grace Wolf is a 55-year-old female, last seen today at 8 a.m., who has active problems of pneumonia, benign essential hypertension, hypercholesterolemia, type 2 diabetes mellitus.
You can see the open microphone button there. This is where I would enter into the conversations assistance. But we're going to hold that thought because I'm going to show you a video about how that works. But now that I'm in the context of Grace Wolf, I'm going to use my natural language to find out more information about how she's doing since the last time I saw her.
Show me my last note.
I found one note, which is for internal medicine office clinic note from Thursday, October 12th at 8 a.m.
Tell me about the patient's vital signs.
Here are their vitals. You can say a name to see the history.
Blood pressure.
Here are the 6 blood pressures for Grace Wolf.
What problems does she have?
You can add an ongoing problem to this visit, or tell me the problem to add. To add an ongoing problem, you can say the number.
4.
Here are the details.
Add to this visit.
Ongoing problem added to the list for this visit.
So really using the clinical assistance capability to add things to the chart, not just find information.
What medications is she taking?
Here are their 5 active medications. To see the details, say the number.
Lisinopril.
Here are the order details for lisinopril 10 milligrams oral tablet. To renew the medication, say renew.
So that actually highlights an important thing from a development perspective. We're still working on the text-to-speech and making sure that it pronounces words correctly. Not usually said lisinopril, more likely to be said lisinopril.
What allergies does she have?
Here are the details for the matching allergy, which is erythromycin.
Show me the patient summary for Grace Wolf.
Here's the summary for the patient matching.
So you can use the clinical assistance to understand your day, get quick highlights into what's going on, review the patient chart just before you enter that room, and then in the future, we'll even allow wake word capability to be able to wake it up during a conversation with a patient. So now I'm going to take you behind the scenes of what we're doing with Oracle Clinical Digital Assistant. So I had a fictitious conversation with a product manager in our group, and we made up a story around a patient having drinking too much chai, and he has some peptic ulcer disease. And we're going to actually have that conversation. It ends up being about a 6-minute conversation, and I'm going to highlight a couple things in that conversation. First, what are the relieving factors that made him feel better after drinking too much chai? And then also, what's the plan that we've come up with to take care of the possible peptic ulcer disease? This version of the application you're seeing is the same application that's being used by our Beta 1 partners today.
Ravi, how are you today?
Hey, Dr. Patel, I'm good. How are you?
I'm doing all right. What makes it feel better potentially?
Yeah, so you laugh at it, but if I get smoothie or anything with milk, cold milk, yogurt, all
Okay.
of those things soothes it and calms it down.
Okay. So I think what I want to do for you is I want you to take the pantoprazole every single day. I want you to take a 40 milligram dose, so that's double what I gave you before. And then I think I want to have you see a GI doc.
So behind the scenes, what's going on? As the conversation ends, the first thing we're going to do is engage the automated speech recognition in OCI. That's going to identify the words. It's a speech AI service, and it's going to say, okay, here are all the words that were said by Dr. Patel and Ravi Sharma. And we're going to get those all together so we know what the words were used. Then we're going to take it and turn it into a transcript. Who said what? Doctor, patient, doctor, patient. Then we feed that information to the generative AI engine, and that's when it starts to create the note for us. That's what you're seeing in the middle of the screen here. So we're going to figure out what goes in the history of present illness, what goes in the review of the systems perspective, what goes in past medical history, and what's the plan for the patient. So it's going to build all of that based on the standard format physicians are used to using every single day. As we get through and the note gets completed, the engineers are now able to validate the information in the note with context of where did it fall in the conversation. So here I'm going to highlight the things we talked about with Ravi around, hey, he said smoothies, yogurt, and milk make it better. I highlight that in the created note, and down below I'm able to see the transcript and where those things came from in the overall conversation. Very important from how do we make sure the AI engine is doing the right things. We're also going to do the same sort of thing for the plan. So we can highlight the plan, understand what was said to Ravi, and that's increasing the pantoprazole, referral to a GI doc, and then we can see that down below. Where did that come from in that conversation? On the far right-hand side of the screen, you're going to start to see the actions that come out of it. Again, we talked about the pantoprazole, and we talked about the referral order for a GI physician. So, cool look back behind the scenes of what's going on in OCI to understand what's the process by how we get to that note. So now, I also get a notification on my mobile device that note is back for me to sign. So I go ahead and open that note. I'm able to see it on my device, of course, and then use my fingers currently to type and edit it if I so choose. In the future, we'll be having the dictation being able to use inside of this view to get the note edited. Additionally, we're sending it to PowerChart Message Center. So now you can see the note in my Message Center. I'm able to open it and edit it. If I choose to use a desktop dictation software tool or just type on the keyboard, I have that experience like I have with my other messages in the Message Center. So really interesting way of thinking about how do we change the physician-patient experience fundamentally. Remove the keyboard, remove the laptop, and focus back on the patient. So let me give you an update of where we're at. My Beta 1 customer went live in October of 2023. We have 11 practitioners that started that Beta 1 program, and they were using it every single day, helping us train the AI engines. Our Beta 2 program is well underway, and we're actually going to target a large number of clients as well as practitioners to add to that training to that AI engine. Later this quarter, we're going to have our limited availability release, and that will be a hardening period where we actually take it, make sure it's performing well, it's meeting the expectation of more end users, and ready to go for our general availability, which will be in Q2 of 2024. After that, we're going to continue to enhance the solution with new AI capabilities, as well as new ways to engage clinicians, providing the best care to their patients. Thank you for your time today. That's all I have. I'm going to turn it over to Suhas to take you through the rest of the presentation.
Thank you to both Ashley and Dr. Patel for their clinical insights and giving that inside access into our modernization efforts. While I hope you're all excited about the future, I hope you also realize that in some ways the future is now. You continue to amaze us in how you're able to leverage data and technology to drive incredible success. It's an honor and a privilege to be presenting this to you, and a huge responsibility that you have bestowed upon us to help you do what you do best, which is take care of patients. With that, I'll hand it back to you, Dr. Feinberg.
Thank you, Suhas. The work your team is doing with our customers is clearly already showing incredible impact. As we wrap up our time today, I want to let you know that you can continue submitting questions and feedback into the Q&A feature. It'll remain open for a little while longer. In closing, I'd like to express my gratitude for your feedback. Thank you for your partnership. Thank you for what you're doing that will have an amazing impact on caregivers, families, and communities. On behalf of all our guests today and everyone here at Oracle Health, thank you for joining another edition of Inside Access. We look forward to seeing you on February 21st at 11 o'clock Central for the next episode of Oracle Health Inside Access. Have a great rest of your day.